Medicare, man. That's
Yeah.
most of our patients.
Yeah, so we actually just rolled out a new Medicare guideline too. So Medicare, when you're dealing with bracing, if you haven't had a brace within a 2 to 5 year span, depending on which orthosis you're talking about with bracing, Medicare is now offering you one. So for example, the back brace is kind of the big hot commodity. If you haven't had a back brace within 5 years, Medicare is essentially wanting to give you one.
How about the E-Stim and then the hot and cold thing?
Yeah, so E-Stim and hot and cold, when you're dealing with Medicare, it really depends on their plan. And so say for a Medicare replacement or a Medicare Advantage plan, you do have the opportunity to get coverage. It's not a guarantee every time, but you can. A lot of factors can play in that, such as meeting your deductible and stuff like that. But usually a lot of patients aren't meeting their deductible kind of to the later end of the year and stuff, so a little bit more difficult. But
how about for traditional Medicare?
Yeah, so traditional Medicare, we do work with them. I've seen some patients have success with getting coverage on traditional Medicare and stuff, but really just depends on the patient's plan. And so if the patient does have an out-of-pocket responsibility, they don't have to pay the lump sum at once. You can actually set up a payment plan through Xonex to where you can pay a little bit over time.
Cool.